Chapter 7, Sample Storage. Topic: General Concepts, Safe Storage of Samples. At the end of this training, learners should be able to define how specimens are to be stored, appropriate storage conditions, and time of storage for each specimen. For safe storage of specimen, cabinets or storage space should be available for securing patient samples and avoiding deterioration, loss, or damage after examination activities. Another important element for safe storage of specimen is availability of appropriate facilities such as samples only or kits only refrigerators. There should be appropriate monitoring using calibrated thermometers for these refrigerators, and there should be a documentation of the same. Whenever samples are retained in the laboratory, there should be a proper indexing system for retained samples. The length of time for which a specimen is retained by the laboratory, also known as retention time, should be specified properly by the laboratory. Retained samples should be monitored regularly and should not be kept for longer than necessary. Storage verification should be done with retained sample verification and, if possible, statistical analysis. Samples that undergo freeze thaw cycles should be monitored adequately. Only authorized personnel should have access to these retained samples. Access restriction to samples is mandatory. There are certain samples which have legal concerns regarding the type of procedure. For example, histopathology examinations may warrant longer periods of sample retention. This has to be taken care of by the laboratory. Now that we have learnt about safe storage of specimen, can you make a checklist of how you ensure safe storage of specimen in your laboratory?